clicking. So today I'm going to be talking about the difference between major depression and persistent depression, also called dysthymia depression or chronic depression. So with major depression, so first of all, for a person to have depression, the neurotransmitter that are responsible for depression or serotonin, norepinephrine, and dopamine. So the major depression versus persistent depression. In major depression, the person is not functional. In persistent depression, the person is functional because it's chronic. In major depression, people normally, their expression would be like, I'm a bad person, therefore I'm being punished, I'm not going to eat, God had snake in my my stomach. In persistent depression, they're more like, that's just the way I am, I'm not going to change, I was brought up like that. And in major depression, you're most likely to see that the person have other psychiatric disorder like bipolar disorder and eating disorders. So the onset of the persistent depression is that it normally starts in early childhood and teenage years. To be diagnosed with either depression, so for major depression, it have to be 2 weeks of consistent signs and symptoms of at least 5 of the DSM-5 signs and symptoms for the depression. Or for the persistent or chronic depression, it have to be 2 years of persistent signs and symptoms from the DSM-5. So with the major depression, you're more likely to find early morning awakening. In persistent depression, the person's going to have difficulty sleeping, and when they fall asleep, they'll have excessive sleeping, also called hypersomnia. So, and then in persistent depression, that's the one you'll see most people overeating. And in major depression, they'll have they won't eat. They'll barely eat. So for depression, a lot of people, like, the first indicator would be like hopelessness, because hopelessness is not only in depression, but it's in people that are more likely to commit suicide. For the treatments of depression now, so for the treatment, it's the SSRIs. The reason being is because the serotonin level is so decreased, they have to use the SSRI to replace it, but it only treats 50% of people. It's not only treat 50% of people, but there is 50% of people show improvement. And then you have cognitive behavior therapy, and then you have the ECT. So the electroconvulsive therapy. So they use that, the electroconvulsive therapy, if all the other therapy before does not work. And for their diets, you would want to give them small meals for depression. You want to give them small meals with high calorie and protein, high protein, because they most of the time they don't want to eat. So you want to make sure that they're not losing weight, and they're maintaining their weight or they're gaining weight. So you want to offer high protein fluids also and high calorie fluids, and make sure when possible encourage the family or the friends to remain with the patient during meals. Also, you want to ask the patient about his or her dislike, because you don't want to give the patient something that the patient is not going to like. So they're more likely to eat something that they like than dislike. All right. So with the insomnia now, for the persistent depression, you want to give them warm milk before bed. That will help with sleeping. And you want to, they can do meditation, relaxation therapy. They can do short period of exercising, but after they exercise, make sure you make them rest. All right. And encourage the patient, because with depression, they normally neglect themselves. So make sure you tell the patient, oh, are you gonna brush your teeth? And you stay with them until they brush their teeth. You give them specific instruction, and make sure that you're very calm with them, because they get frustrated quickly. So that's it.